toothpastes that are good, and the herbal ones are good because they don't have fluoride, and these other ones have chemicals. But hi everyone, welcome to yet another episode in this continuing series of body hygiene, and I want us to delve a little bit about oral hygiene. We had discussed about halitosis being a condition that smells from your mouth, and among the causes of halitosis we had talked about poor oral hygiene. And poor oral hygiene is basically not cleaning your mouth in the right way, or not cleaning it at all, or not using the products that are good for your mouth. Okay, so today I want us to look at the tools of trade that you need in cleaning your mouth for both adults and children, and how often do you need to clean your mouth, and what do you need to use to clean your mouth with. Okay, so I put it out as a disclaimer. I am not in any form a dentist or a periodontist, but I am explaining from a medical point of view and interactive point of view, where I have some knowledge from my dentist on what he advises me to do. So I just want to share with you. And in case you have any oral condition or teeth condition or mouth condition that causes pain or bleeding or swelling, I'll strongly advise that you see a dentist or a periodontist. They'll be able to assist you accordingly. Okay, so there've been some debate going around about the toothpastes that are good, and the herbal ones are good because they don't have fluoride, and these other ones have chemicals. But I want to put it straight out for us that fluoride is important for your enamel, and enamel is the outer coating of your teeth, and it strengthens the enamel. Okay, so when you brush your teeth, you are spreading the fluoride. If you're using the toothpaste that has fluoride, like Close Up, which I usually use, and I prefer this because of its fresh breath and its gentleness to my tongue. So it has fluoride in form of sodium fluoride. You can also find your toothpaste has various fluoride or sodium monofluorophosphorus. It's still fluoride. Okay, so I'll start with the adult toothpastes. And the other time I had talked about Dabur because of the clove in it that helps in preventing mouth odor. But Dabur is herbal and it doesn't have fluoride, so you're missing out on the element of fluoride. So we'll dwell on Close Up because of its fluoride levels, and you will use your toothbrush. And how often do you need to change your toothbrush? You need to change your toothbrush every after 3 months when the bristles have started to widen out like this one. I'm supposed to be changing it in the next 2 weeks because I've been using it from December. So how do you use these two tools? Yeah, like your toothpaste and your toothbrush. Your toothpaste, you're supposed to put a pea-sized, like minji-sized amount of toothpaste on your toothbrush. And then on brushing the tooth is a technique. Okay, you might be having poor oral hygiene because you don't have the right technique of brushing your teeth. Many people brush their teeth like this, going sideways, and the front one going like this, which is a very wrong technique because you're not touching on all areas of your teeth, and most likely you're leaving a lot of debris from your food in your teeth. Okay, so the right procedure of brushing your teeth is the small circles. So you take like 2 parts of your teeth, like if you're brushing the frontal teeth, which is the incisors, you go like this. Okay, these 4 teeth go like this, upwards circular motions like that, upwards down circular motions like that. And on every tooth, at least spend like 5 to 10 seconds on it, because the whole mouth you're supposed to take 2 to 3 minutes to brush the whole mouth. So you go small circular motion repetitively in one space, and then you move to another one like that, you move to another one like that, and then you go and brush up to the back of your teeth, the last molar teeth, and then you brush between it and the gums. Okay, and after doing that, bringing it down or bringing it up from the lower side of the teeth. Okay, and then you go to the inner surface of your teeth. Now you turn your brush like this, The same circular motions around your teeth, brushing like that inside, and then the front one, because it's not practical to do that. You keep on just turning the positioning of your toothbrush. You'll be able to do those circular motions, which are very, very important. Okay, so when you're done, you go to your gum. Yeah, now between them, the mouth and the gum, you rush in between there. Okay, like that, and then like that, and then you go at the back of the mouth and the spit in the sink, and then you come to your tongue. If you don't have something called a tongue brush, which looks like this, a tongue brush, you can use the back. So the back of your toothbrush has rough edges, which can help you to brush your tongue. Alternatively, you can still just use your brush and then you brush the tongue to the deepest part near the throat that you can go, where you're almost starting to gag, then you stop. Okay, because you need to do that. All right, so this is called a tongue brush. You can also buy that, or you can just use your normal toothbrush. And tool number 3 is your floss. The dental floss will help you to remove the particles or debris in between your teeth, like it. Okay, so the technique for flossing, you hollow the tooth to the end and then you bring it out. You go back on the other side, bring it out like that. Okay, so you wash it. For this one you wash, but the one for thread, you move the size of the thread. So this one you just wash, and this one you can use it, you can reuse it several times, like 3 to 4 times after washing it. Okay, and this other side, it has a toothpick side, which is not very encouraged to use because it's very sharp and it can poke between your gums and you start bleeding or cause a wound, which can be infected, and then you come up with an abscess of the gum. So that one we don't encourage to use, but you use this side. Okay, so those with bigger spaces where the floss cannot work, you can use interdental brush. I don't have it because I don't need it. So you can if you go to the supermarkets or the chemists, you'll always find, or the drugstore, you can find a interdental brush, or from your dentist. Why do people have bleeding of the gum? You bleed your gums because, one, you don't floss. Yeah, if you don't floss, there's debris that deposits in between your gum, and then it causes your gums to be frail, and then you predisposes you to bleed. And now I think for the adults we are done, other than the mouth gargle, which I don't use, so I don't have. So you can go for a mouth gargle of your choice. We are using the mouth gargle in between your brushing section. So during the day after eating your food, you stay like for 10 minutes, and then you can do your mouth gargle, so that you are able to maximize on the goodness of the fluoride in the gargle and in the toothpaste. Okay, so why I'm saying to maximize on the fluoride, when you brush your teeth, it's encouraged that it is advised that you don't wash or rinse your mouth. Yeah, what you do after brushing your teeth, just spit out foam from your brushing, and do not rinse your mouth. Yeah, that makes the difference between the people with white and yellow teeth, because once you rinse your mouth with water, maybe you might even be rinsing with salty water, which also corrodes your gums because of the chlorine, and also the minimizing on the benefit of fluoride, which is to whiten your teeth and to coat the enamel and give it more strength. Okay, so we will jump straight to the oral care for the children. And here I am talking about a 6-year-old and a 3-year-old, and it is encouraged that we encourage our children to start brushing their teeth from when they are very little, like once their teeth come out. Yeah, they start having their first teeth, they are ready for brushing. So, and we have the products for them. There is a very beautiful 0 to 2 years toothbrush that you can use. There is 0 to 2 years toothpaste that you can use, that is child friendly. Even though it has fluoride, it's still maximizing on the benefit of fluoride. So don't get scared, or you can have proper advice from your dentist. Okay, so what I have here is from the Aquafresh product, and it has fluoride in it, but the level that is child friendly for my 3-year-old. And she also has a Aquafresh brush that is bear shaped, and it's really cute, and she really gets excited when she's going to brush her teeth. Okay, and all their toothbrushes come in very nice shapes, so it will be a good treat for them. Yeah. And for the same 3-year-old, I have another product. So I got this one just as a stock up, because when I went to the store and I missed these ones, so I just picked this up for a stock up for them. And now I have a third one. This one, it was not a planned purchase, but I had to buy it because we traveled, and then we found out that they had not carried their toothpaste, so we had to buy another one for them to use. This one can be used for up to 8 years. Yeah, up to 8 years. So it's still effective for my 3-year-old and my 6-year-old. So they share this one for now. Yes. So, and also we need to change their toothbrushes, still the same, every after 3 months. And for these younger ones, it's good that they at least have a dental check, because of how their teeth grow, because of how their gum formation and all those things. Yeah. So that should be it about the brushing of the teeth and the products that I'm very excited that you joined in. Kindly let us continue subscribing. Please share our videos so that we can inform one another on these basic life hacks, and no one will be worried of talking to someone or having low self-esteem because either your teeth are rotten or you're not able to eat some foods because your teeth are aching. So if we help one another get these hacks, we will be one happy family. And from me, it's bye for now, and see you next time.